No problem.
Yes,
Just let me know
compact it
when I
and then
should start.
declare it. Yes, start declaring it. Yeah, okay. Just read his resume and then we'll move on.
So I can start now?
Yes, you can start now. Yes.
Okay, yeah. Thank you very much.
We're online already. Yes.
Yeah. Good morning, colleagues, ladies and gentlemen, and our professional colleagues and others who are here. Yes, we're here today to talk about an important topic, which is vital to all of us. The title is Global Perspective on Zoonotic Disease Control. We know what zoonosis is, and we know how it affects all of us. Today, we have on the platform Dr. Otto Muhinda, who will be speaking to us. He has a long, extensive CV, but I will briefly summarize it. Well, he's a Rwandese, but also a Nigerian. I'm telling you, if you meet him in meetings around Nigeria, you will think that he's from some part of Calabar or some part of Borno and all those things. You miss him. But he had been an expert. He's a veterinarian, and he had worked across many African countries. Had been the CBO in Rwanda before. I'd worked in France. I'd worked Rome and back to Africa. Okay, and his love for Nigeria is undisputable. So he is currently the head of the animal health program in the FAO Nigeria, and he works very well with our government agencies, both at the national and subnational level. Today, we'll be speaking to us on that topic, the global perspective on zoonosis, and then we'll be able to bring in our questions at the end of the day. And then based on the discussions we have today, we'll see how the event emanates. So I'll leave the platform again for Dr. Charles Bay if he has anything to tell us, or we take on Dr. Muhinda immediately. Dr. Charles Bay, please.
I think Dr. Muhinda should start off immediately.
Okay, in that wise, Dr. Muhinda, please, you have the floor. You have a free hand to speak, and at the end of the day, I'm sure we have a lot of expert questions that will come to you. You'll be able to interact with us more based on those questions. Thank you. Please take the floor.
Okay, thank you, Professor Fascina, for this introduction, and thank you, Dr. Charles, to invite me on this platform. I accepted the invitation because of the interest I have, not only on the profession, because we need to always exchange, educate ourselves, share experiences, etc. But most importantly, I'm a follower of your platform. Every Saturday morning, I will look at it and see if there is a topic, because topics that we are discussing are only actual topic, but they are also important for the profession. So thank you very much for this opportunity. So today I will speak as an expert or somebody as a veterinarian who is in the sector. I don't want to have the heart of FAO, because whatever opinion that will come today in this discussion will be my own opinion. It will not be FAO opinion, because we have, I think, some time to differentiate whatever somebody wants to do and whatever responsibility the organization gives to him. So I'm very happy to start provocate this discussion on zoonotic disease and its global perspective, because we all know that what zoonotics are these infections transmitted between human and animals. We know more about what is transmitted to human from animals, but people tend sometimes to forget that humans should also transmit pathogens to animals. But this is also somehow a debate globally. But these infections require really a global interest because they constitute 60% of current human infections and 70% of the emerging outbreaks. Today, 70% of emerging outbreaks are zoonotic. They are coming from animals to infect human. So at global level, there are many infections. I will not list them. There are so many. Maybe some of them I have never even seen. But I will talk about some who are with probably a priority address, including avian influenza, pathogenic avian influenza, the Lassa fever, the monkeypox, yellow fever, anthrax, bovine tuberculosis. Today, people are talking about Ebola. So I will extend a bit on AMR because AMR is also a threat today. Many pathogens are resistant to the antimicrobials, and they constitute also something very complicated. So recently, we had the COVID-19 that has devastated 20 million globally in 2020, according to the report of WHO. Lassa fever is a killer almost of between 10 and 50,000 annually. Avian influenza started in 1990s, and it has reported to kill since 1997 in Asia like 1,000 cases, but it has been reducing now. It is no longer killing, but in 2005, they recorded almost 500 human deaths from avian influenza. Yellow fever is almost killing 80,000 people annually. Anthrax is killing almost 100,000 people annually. So they are very important zoonotic disease. So you remember before we talk about our framework that we have today, that was established almost in 1996 and 7. Avian influenza appeared as the most strange and threatening zoonotic disease, and it has actually provocated the global reaction. In China, it appeared in 1996. They identified quickly H5N1. But before that, there was a virus identified as influenza A virus that has been identified in 1955 as a FAO plague in Europe. Then after that, people tend to be silent about it until it reappeared in 1996 in China. And in 1997, the first human case of H5N1 appeared in Hong Kong. And that time, 18 people were identified and 6 of them died. So the pandemic had a global spread in 2003 from China, Hong Kong, growing in the whole Asia, Middle East, Europe, and then Africa. So in 2020, that is when the avian influenza was identified by the WHO as a global panzootic H5N1. But there are many clades. I don't want to enter in this. In 2020, we started to hear about cases in mammals, etc., etc. So HPI has been the one of the most important zoonotic disease that have awakened the global health system. Around us in Africa, we had the monkeypox that was also declared by the World Organization of Animal Health as emergency of global concern, emergent threat for global concern, was declared in 2022 by WHO. But monkeypox is not new. It has appeared in 1958 in Denmark, in a zoo where people were having monkeys, and that is where the first signs started to appear. And in 1970, first case of human cases of monkeypox appeared in DRC. And then in 1981, 86, WHO started to address it, creating a project, a perspective of fight against mpox. But mpox appeared grown again. In Nigeria, we had this outbreak of 2017. And in 2022, it was also declared an emergency threat for global concern. And it has expanded to 120 countries, including America, UK, Singapore, etc. But quickly, the system of fight became very efficient. In 1 year, the WHO addressed all the issues. In 2023, this state of global emergence for global concern was removed, but is still around because we have 4 clades of mpox. Clade 1, which is endemic in Central Africa, and clade 2 is endemic in West Africa countries. So many threats, zoonotic disease are known today. That's why the international community put in place a governance system. They created around 2004 a balanced and optimized approach for human, animal, environment, and plant health, which was a think tanking of UN system to address whatever happens in a systemic way. And in 2010, 3 major international organizations put together the effort to address the complex of all these threats from human, animal, and the ecological system. So 3 organizations, WHO, FAO, and OA, created the tripartite in 2010. Then in 2000, this was working between 2010 and 2022. And in March 2022, UNEP joined the tripartite, and they formed a very historical memorandum of understanding, an alliance with the 4 international organizations, which became a quadripartite. Today, whatever is done at the global level is respecting this kind of strong global alliance formed by the 4 major international organizations to address the complex threats at the intersection of human, animal, plant, and environment. I will not go to all the details. I will not talk about whatever happens in many countries, but I know that here in Nigeria, we are also working in One Health platform, bringing together institutions that are in charge of human, animal, environments, and plant health, including ministries, including other attached institutions, which are really putting together efforts through what we call One Health strategic strategy. We are now at the second generation of it. We have expanded from not only disease, but we are now going even to AMR. AMR is becoming important because we have identified that EMA is also a killer at the global level. We are addressing food safety. We are addressing workforce development. We are addressing laboratory development to make sure that the diagnostic is done in very comprehensive manner. So we are aligning at the global perspective of the control of zoonotic diseases. So maybe this is the introduction I wanted to do. I want to start with. It is an open discussion. I don't say I have the whole truth of it, but it's an open discussion. We can take from there and probably discuss up over the moderator.
Yeah, thank you very much, Dr. Muhinda, for this opening statements and discussion on this matter. Definitely, I'm sure there will be questions in the platform, but I will also be probing you with some questions which can open up the discussion. One, if I may start, let's think of operationalizing One Health resources in resource-constrained country, because we know when you talk of zoonosis, you cannot divulge it from One Health and how things emanate. And we know that operationalizing One Health in resource-constrained setting may be beneficial. So I would like to ask Dr. Muhinda, the One Health approach is widely endorsed as a gold standard for zoonosis. However, we know that still in many low and middle income countries, human health, animal health, environmental health, and others, they tend to operate with separate budgets, separate reporting line, competing priorities. And because of this, it doesn't make the One Health to work as seamless as we have want to see it work in terms of tackling zoonosis. So from your global perspective, what are some of the most practical, high-impact first steps that you think a country like Nigeria can take to break down these silos without waiting for major legislative reform? You know, if we have to wait for legislative reforms, we may wait for long. So what are some of the practical things you think a country like Nigeria and other African countries can do to break these silos?
Okay, there is a lot of developments country by country. Some countries are very quick, rapid, and others, because of maybe the bureaucracy, whatever, putting in place laws and whatever is almost difficult in all the countries. Some countries are very quick in reforms. They will create quickly a framework, but others, where, as we say, human, animal, plants, environment have been working in silo, is difficult. But the best practice that we are learning from many countries is to establish a kind of multi-sectoral platform. That is the first step. Bring together, there are 4 organizations at global level. It will take time, even between FAO, WHO, and others to agree, because people will say, oh, I have in my mandate agriculture. Food security was a mandate of FAO. Human health was the mandate of WHO. So to agree that 70% of emerging diseases are coming from environment has taken a lot of time. Between 2004 up to 2010, experts were discussing about it until they accepted to create a joint program, 2004. Now it has evolved in a joint center. There is a joint center that is functioning between FAO and WHO and the International Energy Atomic. So there's a joint center now, which were joined in 2010. That became the tripartite. So, and after 2022, UNEP joined it. Now there is a joint center, a whole big division that is based in Geneva. It's not even based in Rome. It's based in Geneva and WHO. But veterinarians from FAO have joined, environmentalists have joined. So for each country, that is the first step to go. Bringing together ministers or experts. It starts always by experts who are in charge of human health, vets, environment. In Nigeria, we are lucky we have NCDC, which is the coordinating at the technical level, then the Office of the CVN, then the Director in charge of Environment, Sanitation, in the Ministry of Environment, and then the Director of Plant Health in Ministry of Agriculture and Food Security. This is the technical group of leaders. And then they bring all the experts forming a platform. It starts from there. And after bringing the platform, creating the platform, you create a work plan. Huh? NCDC will be obliged to do it because they have this what they call the joint external evaluation every 3 years. So they need to evaluate the health sector, and the veterinary side they will be having this PVS, the performance of veterinary services. We need to evaluate it also. Instead of doing it in silo or one by one, we bring some components which are touching to the all sectors together. Then we form a platform, we look at the gaps together, and then we address it through a work plan. It starts by always by work plan. And then from a work plan of 1-2 years, you will move to a strategy. How do we address common threats? How do we address the zoonosis? How we go for AMA? How do we go for food safety together? How do we bring national parks to know whatever spillover is in the environment? Then after this kind of work plan and strategy, then we move on looking at the budgets, bringing development partners, bringing those who have expertise like FAO and the WHO, etc. And this will move later, okay? In some countries now, this is a kind of coordinated. If you go to US, you will see Minister of Health, whatever, it will be a very big ministry bringing together all these entities and addressing it. That's why sometimes US created through USAID, they created the ECTAD. ECTAD was a kind of emergency center for transborder animal diseases, but was created in 2005 to put together all this international data so that when we have a threat somewhere, it will be quickly reported, and the response will be, we move. We will move from that strategy and go now to prevent, detect, and respond. Because we know the threat, then we can prevent them. That is how it is addressed at global level. But each country will take the steps according to the bureaucracy that will exist. But you can also know that at the global level, it took almost 20 years to move at that kind of strong alliance and create a center that brings together all the organizations. So if it takes 10 years for a country, it will be
Exactly.
ideal, you know.
Yeah.
I
Thank you.
understand that
Thank you.
it's not very easy to make it.
Thank you very much. Indeed, that's why I added that component of the legislation, because at times you see when countries or when you are calling people to work together, I say, oh, but there is no law in place, there is nothing that gives us room, there is nothing that provide room for interministerial engagement. But thank you, you've broken it down very well. The first thing is to try to form together a group, like a technical working group, which is cross-disciplinary and it's transcending different ministries. So it's interministerial. And then to take advantage of the available tools, like you talked about some tools, we also have the joint risk assessment through which these different organizations can prioritize their tools. And you've also talked about the data sharing available opportunity you have currently. How are you able to work across board without waiting for the official engagement yet. Yes, the official engagement may benefit when they begin to see that you are doing things together and it has co-benefit. And then you also talk about investment. And these investments should be both local and international. When we are thinking of local investment, the national, between the different ministries, can we put together resources to jointly address issues before we even think of international partner coming in to help us? So I want to tell the audience that this is not a monotony and it's not a lecture, a straight line lecture. So if you have questions, please feel free to either type it in the box or raise your hand. We can take your question as we go along, please. So if there's none, I can go ahead and ask
go to
you
the chat.
another.
Go to the chat.
Yes, I've already checked the chat. There is nothing.
No, there's one. I heard them, Prof. I heard them.
Okay, yes, I now see one, Professor Ayedo. So, yes, there is a question for you, Dr. Muhinda. What are the impact of insecurity on the control of zoonosis? Yes, that's a question that just came in. The impact of insecurity on the control of zoonosis. Let's take that.
Okay, the impact of insecurity is wider on many sectors. Let's start from whatever I do on an everyday basis. Food security, impact on insecurity on food security is very huge. Impact on insecurity on controlling the transboundary animal diseases is very huge. How do we control the diseases? How do we prevent? We are organized to prevent the entry of this and this. When you have an outbreak, we go and for investigation and we put a response together. So if you are not able to do investigation in the area because of insecurity, you are automatically avoided to take any action. So the impact of insecurity is really huge on all whatever you are doing. Of course, zoonotic disease response will suffer. We had a case sometime anthrax. When anthrax came in 2024, we were said it came from Ghana. But when you had a case in Suleja, we were able to go there and quickly put a response, vaccinate animals. If this area was not accessible, so what would have been an impact? Very huge. So it's very important that we took into consideration that. However, putting together all this platform will also talk to those who are on the field. So when they are on the field, they are able to say we are able to intervene there and there. But if you look at it, whatever happens in security will worsen always the any action, any response that anyone want to take.
Thank you very much. Yeah, because that also talk to issues like, for example, if you have health facilities in an insecure area now, suddenly it becomes abandoned. The doctor cannot go there. The vet cannot access the facilities there. If you are having a systematic reporting system that involve the insecure place, automatically there's a break in the reporting line. So you don't get optimized information again. And then such a community now become left behind in terms of services and delivery, surveillance, intervention, response, detect, all those things. You cannot do it when there is insecurity, unless you then form partnership with maybe the NGOs or international NGOs that work in insecure area. Then you may be able to manage such situation very slightly, but definitely insecurity mitigate or militate against good work in terms of detect, respond, and all these things. So definitely we have that impact. So there is another question here. Said the environmental component is actually underrepresented in One Health approach. Please, how can we bring the environmentalists to actually be fully involved in One Health approach? This is a question coming from the Ministry of Health. Please, you have the floor.
Okay. Let's say that even UNEP took 12 years to join the tripartite. I told you it was created in 2010 and UNEP joined in 2022. You understand? So even if this have taken some time, it means that somewhere, somehow, they thought that they're not concerned by the diseases. UNEP was looking at protecting forestries, oceans, whatever. But when we started to feel that 70% of emerging diseases, those diseases that exists in 1950, 70 are coming back. That's what we call the emerging diseases. And they are coming back because people are touching to the environment. We were talking about this, how do you call it? Fruit bats that appeared in Benue State. Suddenly, they become a threat because people went to their area. So, environment came in while people are going to the habitation of the wildlife. So, it's good that now, since everything is understood, whatever you're doing will convey environment expertise. Maybe it took some time before, but since we have started to talk about One Health platform, technically, I'm aware that the Directorate of Environment is involved today, very much involved, and the Minister of Environment have joined the Ministerial Standing Committee, which is under the coordinating Minister of Health. It's supervised by the ministers. The ministers are rotating to be the co-chairs. So I think it's now time for the environment sector to bring their contribution to One Health. If they bring more contribution, we are talking about mobilizing international resources. So the component of environment will also mainstreamed. When we talk to international donors, those who are concerned by One Health, currently we are talking to the Pandemic Fund. Everybody knows the Pandemic Fund now. So the Pandemic Fund advice is to make it multi-sectoral. If environment does not appear in that proposal, the money will not come to the country. So it means that environment has to take their role, because now we know that majority of the outbreaks are coming from the wildlife, from the environment. Then I think it's time, and I think we are doing efforts. Effort is done in the country to make sure that the environment is not left behind.
Yeah. Thank you very much, Dr. Muhinda. Basically, the summary of some of the things you are saying, we include things like you need to formalize the environmental sector representation in One Health. For example, when we found UNEP joining the tripartite platform to become a quadripartite, we saw the immediate change, immediate thinking around environment and environmental issue changed. Because initially, when you talk of zoonosis, people think it's health. Zoonosis, health, zoonosis. And environment previously don't see why they are important in health. They will be more important the ocean issue, they are more important the climate action and all those things. But immediately they came into the fold, you begin to see the transformation that we begin to have even in the implementation of One Health, formalizing them, adopting shared metrics, maybe data that we can see from the wildlife, because human beings will continue to incur into the wildlife environment. So continuously, we are getting new diseases, we are getting reimagined diseases. For example, think of disease associated with monkeys, associated with baboons, and all those things in the wildlife. If we never integrate the ecosystem and the environment, we will never be able to get ahead of those ones. Think of a disease like Lassa fever, which had been our major problem for a very long time. Do you notice today in our management of Lassa fever, the environment are still not critically integrated? Think of it. We think of the hospital level management. We think, oh, we want to save the doctor from contracting infection. We've lost a number of doctors. I think last year we lost about 12 doctors due to Lassa fever in Nigeria. What will stop us from taking care of it at the environment level? Integrate the vets, integrate the environmentalists, let the mastomyces natalensis, the rat that creates this problem to start with, let them be removed. And then you will not have the case of Lassa fever. So these are some of the things we need to begin to think of. I think it's also important for us to begin to think of joint training in our university systems, wherein you have some lectures that include the environmentalists, the public health, the animal health people sitting together in a class and thinking around issues together, even as students, and then trying to provide solutions. We also should be thinking around nature-based solutions. We shouldn't always think of complementary medicine. These are modern medicine, our modern way of doing things. Let's look back. For example, we hardly integrate the communities in terms of our planning when we are thinking of planning for zoonosis and things like that. So we need to begin to think of that and then think of aligning our policies to make sure our policy can bend backward and accommodate extra ministerial involvement. For example, if you know in time past or maybe up till now, many ministries say, oh no, this is money for the Ministry of Health strictly. It can't be used to solve anything outside the Ministry of Health. This is strictly money meant for malaria program. It can't be used for anything outside malaria in the hospital environment. So I think some of these things will really benefit us, and then we need to engage them also in terms of our surveillance. And also, one of the things we actually lack generally in terms of science and the field of science is that we hardly demonstrate mutual benefit. We hardly demonstrate cost benefit of what we do. And so we talk as scientists. We like to talk to our microscope. We like to talk to our sciences. But we forgot that whatever we are doing still impact on the society. So we need to begin to have this social science mentality as part of our work. Think as an economist, even when you're a vet or a medical doctor or an environmentalist. Think as an anthropologist. Think of, okay, this thing we are doing, how does it impact the environment? So thank you very much for that very good question.
Yeah.
We've got another question. Yeah, sir, Doc, please speak on. We
Yeah,
have another interesting question from a student, but I'll talk after you.
Yes, you talk after me. Somebody mentioned about using security forces during the outbreak investigation to reduce the impact of insecurity. I think where the security forces comes close here is blocking movement of people. And we saw it during the COVID-19. Fortunately for me, because of we are in essential duty, and based on that, we are given permits to move around. I had opportunity of moving my products with my driver because of the limitations of other workers moving. In the night, they will block. In the night, that's when they will block some borders, and then you start settling them. And once you start settling, they'll be releasing you. So it became a bazaar for them. But policy. Fortunately for us, up to today, I've been asking questions, even to people who have been able to come across with. Why is it that the spread of COVID was drastically reduced in Africa? Because in New York, I don't want us to say it's a Negroid disease or it's a Caucasian disease or whatever, because in New York, where I was monitoring, I was calling because I had relations there. There's a lot of mortality. People died in drones. And then when you look at the news all over the world, especially in Europe, Italy, maybe, and we see that they have responsibility in attending to the law. If the law says don't do this, you don't do it. Or law enforcement agencies will come against you, unlike in Nigeria. But when we look at the volume of people that died during the COVID-19, you can see it's so drastic. It's so drastically low compared in other times where the discipline is preeminent. But be it as it may, using security forces means you need to have extra tag on those security forces. Those for them to do their job. If not, you pay them well. the detachment, the special unit that will monitor that will block people here and block people there, they should be paid. If they don't pay well, they will fall back to what we know. Thank you very much.
Yeah, thank you very much. That's a good contribution. But you need to know that everything is not about hammer and brick. You don't hammer, you don't. Yeah, enforcement should not always be our last thing. We should also think of getting people to willingly want to cooperate. That is better than trying to enforce because, as you rightly pointed out, even when you enforce, people may want to, okay, can I bribe my way to go through and all those things? These things do happen. So we have an interesting question from an aspiring zoonotic disease specialist, a student from one of our university. He's asking, Dr. Muhinda, please, what advice do you have for me as an aspiring zoonotic disease specialist? So maybe how should he begin to prepare his mind? How will you like to advise him in terms of getting into this field? He will soon be graduating. Thank you.
Okay, that's a very nice question. It brings me to my whole history when I started from. When you finish university, maybe you don't have all the knowledge, and you need to develop your capacities. So I have even advised some students in Zaria University to start to put in place a small club where we'll go and discuss with them about zoonotic disease, especially for them to develop their capacities. A small club on zoonotic disease, on One Health, at university when you are a student, and when you graduate after that, you will probably know majority of these things. You have information. And when you have a club, also, structures that will address the information that you have. So when you grow, you specialize, you will even know the One Health platform. Because when you're a student, you don't know whatever happens. So you grow, and you will know all the structures that are there, and then you will know how to align your career. Because uh, the zoonotic part of the vet career is also vet. So you specialize in whatever disease you want, but you need to start early to educate yourself, to know whatever is there, to know whatever is needed. The component of human health. In the past, when we were in the school, a vet will never try to know what happens in the faculty of medicine. Is it true or not? I have never the faculty of medicine at university was just next to the vet school. But I never went there to know what type of vaccination they are doing, how they do it. But today, because the framework is there, you will even know that at university, the, school, the curriculum is this, and your curriculum is this. Then you compare, you start to grow and grow your knowledge and capacity. And then when you go to the field, you will find a platform, you will start to know the collaboration where it is, where it's not. Also, there are a lot of gaps that we need to fill at the university level. Huh? Uh, since one health is not only in the ministry, it should happen also at university. Specialists in a university in charge of this disease and the other one should talk. That is the future of what we. That is the one when we talk about the global health security. Is the future of the health. The security is the health is one health. So professors in the faculty of faculty of human medicine, they should talk and create a kind of curriculum that will be shared between medics and vets. That is important. Why? Let me come back again to the environment. Why the environment is not visible enough? It is because the School of Environment will be 5 kilometers to the faculty of vets, and no one will talk to each other. At some national level now, if you go there, we have people in charge of environment speaking to the DVSs of the states, are having the same meeting at least once a month. Do they talk? Is there any coordination that is done at that level? So we have a lot of gaps. All these have been identified through the last joint external review of the health sector and the previous that is coming. So all these gaps will be probably addressed. But I think this career on One Health will also about individual efforts. You know,
Yeah.
when I finished my school, I did not even know what happened. But I know all the list of all animals that were and all diseases on animal health. I never know that when I be in Nigeria, the bovine tuberculosis will be among the seven strategic disease to address in the country. When we are in school, are we doing effort to know what is the pathogen for bovine tuberculosis in human? Is the same in the pets? So if you do this type of individual capacitation, probably you grow in knowing what One Health is. Because somewhere, somehow, is also about the career you want to go. If you want to go to work at WHO as a vet, in that division of WHO, you need to educate yourself, specialize yourself in one of the disease, maybe go also in the AMR, etc. You need to educate yourself when you are young because it's very wide. It's wide when you talk about it. But at the end, the most important, you need
Yeah.
to integrate your capacities in One Health area so that
Yeah.
you
Thank you
yeah,
very
you
much.
Yeah.
ensure
Thank
yourself.
you
Yeah.
very much
Thank you.
for
Let
this.
me let me add something here.
Okay.
Based on my little experience as an undergraduate who was so versatile, because our first contact was in first year, where we met biological students from, what they call us
Mhm.
life scientists, and then who had to study. We did a lot of courses in biology, chemistry, physics. So we're in contact with um, undergraduates from medicine, pharmacy, biology. Yeah, some disease, some whatever. So let me just conclude before I just go back there. So I figured out that if I'm in a silo to study, I might not go far based on the volume. So I needed people from biochemistry when we are studying biochemistry. That's as we continue moving. I studied with biochemistry, one of the finest, but he's a professor now at Professor Lawrence at UNN. He was the one that made me understand basic, based on the areas we are doing in biochemistry. I studied and I was giving him the points I learned in class. He was giving me, and then I will move on to third year. And then fourth year, when we started doing pharmacology, I studied pharmacology with pharmacy students. We discussed it. We had areas in a class we will come, we will start talking. They were not vast in anatomy. There are some anatomical terms they meet in pharmacology. I'll be the one to explain it because we did anatomy to a level. Then as I was moving on, even physiology, I studied physiology with medical students because I used to go to Enugu campus. Medicine and medicine and to some extent pathology. I studied it. They will be talking, we'll be discussing. These things like necrosis is necrosis. Coagulating necrosis is coagulating necrosis, whether it's an animal or human being. They don't. The important thing to get the baseline. And I think one thing I will tell students, and I'm seeing a student here, is let them be calling. You have an association. Then our own is AVMS, Association of Vet Medical Students. I don't know what they call it now. You can, as a student, as a group, bring in experts to be talking to you from outside. Nothing as good as external lectures. Lecture, you don't take exam. Lecture, you go out of interest. You can see you are not squeezing your face to cram to go and deposit in an exam sometime. It goes a long way. It broadens your horoscope. So that students should know that as students, I remember when we were students, when I played students in politics, actually. That's why it's not easily a side attraction for me to go and start studying with these people because I had minimal time. So the little time I have to study, you see, and anything that you do out of discussion, even in your class, after lecturing, you can see this person will bring you match, you move forward. And don't work out from students. Don't work in silo. Don't work. I remember one medical student. He was working in silo. He was not mixing up with anybody. We were having all our exams in the morning. He thought practical exam would be in the evening. Sorry, we were having our exams in the evening. He went to study, read. By the time he came, because we were living in 6 flats together, he saw us coming from exam hour because I was not mixed with anybody. So coming from exam, he was surprised. And you know, their medical school, they will second year, they will continue from Enugu campus. That means he must pass that exam in supplementary for them to release him to go to Enugu campus to continue his medical studies. So these are little things. Don't work in silo from student to everywhere. Okay, there's something. If you really want to know the environmental stupidity in our system, go to the abattoir. Go to the one they call slaughter slab. Up to today, they're using tire with attendant chemicals in tire to flay the skin of animal till tomorrow. Meanwhile, they have ruminal content. They have abattoir byproducts they could have used to generate biogas. What is, even as a national policy, what is wrong? Is it a rocket science to go to Kenya, go to your place in Rwanda, see the impact and the influence? Thank God, you've been in Tanzania, you've been in Kenya, you see the influence of biogas. In fact, it's reducing a lot of funds in energy. Some of them are even in Kenya using to power generators. And we have the here in abundance, the raw material in abundance. We are not using it, we are using tire. What is wrong? Constructing a system where you deposit all these materials and then you put digesters to release the gas for you. Is it rocket science? You know, these are areas, and you see, one thing about Nigeria is if you call a spade, and government brings red eye on it, you see things change. But most time, government officials are aloof. Aloof in the sense of let them be doing what they're doing. And then you'll be eating byproduct of tire in your menu, in your food chain, in your food web. Not even only food chain, food web. You see it's circulating. Tomorrow, if there's an outbreak of cancer here and there, you say, where are we picking it from? So that's the thing. I mean, that's the reason why we should have topics like this so that we start generating, and people like us from the field will be telling you the best line through. Even the abattoirs, they will have a beautiful abattoir system. Because of lack of maintenance, everything will collapse. The one in Kaduna, see burial ground, cemetery. Very close to River Kaduna River. The cemetery is close to River Kaduna. Once there is the river overflows its bank, from there, the cemetery, you will see they don't have all their water, whatever, their boreholes that have all collapsed as at the time I went there. So they'll be collecting water from that enters the cemetery. And it will enter into the into the abattoir, and they'll be using it to clean animals. Maybe they have done something better now because we shouted and I shouted and shouted and shouted. So we have a system failure in some environmental control of diseases. Okay, you can continue.
Yeah, thank you very much. Quite an interesting discussion. You can see that the discussion is not theoretical. We are practical here, and a lot had been said. Indeed, interestingly, I even didn't know that this will come up. This morning, I was talking to a professor from one of our university, and she was telling me about how one of our students just submitted a project on perspective on zoonosis and One Health. The first question I ask is that, where was the study done? Is it only within the faculty of vet science? Also said, no, they did it across all the 10 colleges in the university, which is good because it means that you are also getting opinion of other other professionals and see how they align. Indeed, it would have been good to then compare how do these other professionals view zoonosis and AMR compared to how vets and how medical people sees it. So these will be things that are interesting in taking us into the future of how these people will work, even when they get to real life. There's another question, but before I take that question, I would like to recognize Eugene Chukwuibe. Sorry, I won't put title because I couldn't see the title here. So please, you have the floor, ask your question, and then we can move on with another question that I have in the comment section. Thank you. Over.
Thank you, sir. Thank you for this morning, and thank you for all we've been doing here. Okay, mine is more, okay, I'm a veterinary doctor, sir. I'm in Enugu. Mine
You
is
were
more
the former
like,
national treasurer of MVMA. Continue. We know you're.
Thank you, sir.
Continue.
Okay.
Okay, so mine is we what we're talking about now is we're trying to explore the One Health. This One Health emerged even after some of us left school, and we are taught that we are vets, and our jurisdiction is vet. We weren't taught to have these collaborations we're talking about now. Now that it has come, and that's the way the world wants us to go. FAO, WHO, World Organization for Animal Health, everybody, we're talking about One Health, and that's the way out. My appeal is, how can we now get all the councils regulating the professions that are very key to One Health, human health, veterinary, agriculture, then to environment, to now have a way to integrate, this common ground in all the faculties or in all the learnings, such that a vet doctor can have a class with a medical doctor in areas that concern One Health. Just like what we've been saying. If we do not start it in the school level, we'll see how graduates who come out and feel they are working at parallel. But if we start it at the school level, then we'll come out with this idea that we are, delivering a holistic health. Everybody comes in because he knows that we are all coming together. So that is where I am coming from, because we in the practice we have had several seminars and workshops where we bring in all the people in different professions, medical, vet, environment, to come and talk about One Health. It is not gelling. Some states have also started some kind of committees, One Health committee, where they have meetings in one month or bi-monthly, but it's still not gelling. But I feel that it will gel more if we start now, the next generation, to key it inside, impute it inside the curriculum, so that they will, from there, meet together and move on. That's what I want to say. Thank you, and have a nice day.
Thank you very much. Dr. Muhinda, before you answer that, there is the comment on the side comment also aligns with that. So let me read it so that you answer together before we take the README question. On the comment section, there's one that said that One Health is mainly driven from Abuja at the national level, with only the medical and health coordinator attending programs at the state. How do we ensure other components like the vet, animal health, environmental health, lab also feel the impact and get involved? So basically, Dr. Eugene had talked about the situation right from the academic campuses now into real life based on this question. Please try to answer the question together and give us your perspective.
Okay. The perspectives is this. The last joint evaluation, external evaluation of the health sector in the country, and the last situation analysis that we did also on animal health, One Health in the country, has shown that there is a very weak coordination at the subnational level. It's known, and it is something that is needed. We have all been advised to improve the subnational level, and we are working to operationalize a joint zoonotic disease surveillance at subnational level, at least to start from there. Joint to operationalize a joint surveillance of disease at subnational level. Subnational level means start by states, but we think you can go up to even the local government, including the public health, animal health, and environment health sector. We'll be starting by maybe doing case definition, reporting protocol harmonized between human and animal health, do a community-based events surveillance linked to the facilities that exist in the area, sampling together, bringing the diagnostic in the laboratory, doing risk-based surveillance strategically targeting high-risk interface. If we go to the animal markets, abattoirs, wildlife conservation areas, we should go together with all the three sectors to make sure that we operationalize this activity that will help people at some national level to work together. Even trying to create those One Health committee together. We need to create a committee, but we need also to create activities that are bringing the mechanism together and feedback to the at national level. To respond to Eugene, I think today is what I said. Faculties should talk. I know in some vet schools, some vet college, they have created a master's degree on vet epidemiology. There is always a master's degree in human medical epidemiology. But bringing this to the two sections together and create a master's degree in One Health epidemiology, so that will speak to those who have this kind of lack of knowledge. And this is something that we also we were discussing with the faculty of medicine here in the University of Abuja to create a curriculum that will go down. The vet should graduate, knowing that he is going to meet and address diseases that are subject to be transmitted to human. It is an information that should be passing through the training today, because as you said, One Health emerged in 1980s, 2000. Those who graduated before that, myself, I graduated before that time. So, but I had to train myself to know it. So today, students should get the little information, at least in the curriculum, to know that the future of vet career and the future of One Health is based on the knowledge of diseases that could be transmitted to human. Because at the end, they will be obliged to address them. So I think the curriculum should also be revised. We had this discussion in Abuja, which is next to us here. But I think it is going to be discussed better at a certain level so that students will have minimum information when they are undergraduate. Those who want to specialize, probably they will be creating some master's degree or very specialized on One Health. I hope I have responded to the two questions.
Thank you. I think you did.
But I think, I don't know. I think from my own perspective, because originally, Minister of Health, Minister of Agriculture now condescended down to Minister of Livestock. They have public health departments. But I don't know. Maybe because of tight budgetary control or whatever I will call it, they were not living up to the standard expectations. I will tell you, if Nigerian police is doing well for fraud investigation, there's no need for EFCC and ICPC. And if these people have done well, They will only if there's need, because I think NCDC is a contraption of CDC in America, because they started this One Health or whatever. I think quarantine in Atlanta today. So what I'm trying to say is that effectiveness of all these departments can drive us far, but unfortunately, this is what I was saying. Living in silo, quarantine somewhere else will not assist us. There should be a breakup.
Let me tell you that since 2023, okay, at least the information that I have, the Department of Vet Medicine and Public Health and the Department of Public Health and the Ministry of Health, they are talking. And they are talking to bring in even the Department of Environmental Health and Sanitation. So already these are three main departments in
You
the
say
ministry.
since 2023 till now, somebody is talking.
No,
and
they
there's
are
no
talking.
effect.
They have created
Talking. What I'm saying is
a common work plan, and now we are going to a common strategy, and this will lead to a budget that will help everyone to implement
until we get there.
activities on one hand.
We'll continue to hammer. Maybe we
Of
will
course,
fast track them.
of course, we still have to
maybe we'll
go
fast track them. How can you be 3 years? You've been talking. Within a year, the work plan should have to, if you have expert, the work plan should have to supposed to be on the table. Then execution. In the second, maybe by 2025, there will be execution. By now, we would have been seeing the effect of the execution. That's why, since we are not seeing anything.
The work plan said what we had been planned is to maybe even at some national level to select one disease per state and say this is the main Hamas disease in the state. We are going to address it together. That is one example. They still have their differences, but at least at One Health level, they have decided to put effort in some of the disease for surveillance, for response, and for prevention. So I think things are evolving and they are moving.
Yes,
Of
definitely.
course, we need to continue to do effort, but things are moving and are evolving. 3 years is not big, but I'm sure in the next 5 years, this new strategy that is coming in for 2026, 2030, people will see the differences. We will start to see joint laboratories doing surveillance together, because surveillance is even the most important. Before you bring a response, you need to know what is there. Why this? Why this? So once you have the whole framework, then you bring a response. So joint surveillance is happening. Joint AOC at state level is happening. I have examples. Lagos State, we went there when there was anthrax. Zamfara State, we went there where there was whatever. Even Kaduna, there are some of the states that are, even Borno State, there are some of the states that are doing jointness now to make sure that the two sectors, even the three sectors, they're adding environment. This year, we are doing proposals together. I speak on behalf of all of them, but I know that this effort is made. And the ministers, I can tell you, I have the Minister of Health, the Minister of Livestock, the Minister of Health. They will speak at least every month about this. We are supposed to have this global AMR conference in Nigeria. It came to Nigeria because we are already advanced in these AMR issues to address the AMR issues. So a lot of effort is made. I think we will see the differences in the very near future.
Now, then another thing is, Dr. Nahoro is here. When he was NVMA president, I was his ex-official. There was an attempt to bring in NMA and NVMA together into having a journal, a periodic journal. I don't know how far it's been as at now. Nahoro, please unmute yourself and if you have any information here, whether we are continuing or we discontinued, or we're continue to continue or to continue to continue. Inahoro, please, is he with us?
Yeah,
He's
was
with
on the
us, but you
platform.
know,
Let
most
me
of these
see.
most people, when they're with us, something can distract them, either to go and wee or pee or whatever.
Uh,
Anyway,
I think it's not on the platform at the moment, but definitely what you said is valid. I can see if I can bring him back. So thank you
no,
very
he's
much. I
here,
think
he's
that
here,
this
but he's
issue.
not. I saw he's here.
One hand has been up for a long time.
No, we have two hands up. We have two hands up. It's not on the platform at the moment. I've checked the list of names that are still here.
He's here.
Yeah.
Inahoro is here. I'm seeing him right now, but towards the end. But maybe anyway, I will call him. Don't worry, I will call him. Continue.
Okay.
Hands are
I've
up.
seen
Don't worry, he will
his
not
name.
penny
Okay.
his
So
electronic
we've
hand.
got two hands up in this order. The red me to speak first, followed by Dr. Chieloka. Please proceed, red me. Tensi.
Well, I had put my name permanently on this thing. Why is it being read me? I don't know. My name is Michael, and my father's name is Asus. I'm a retired
Professor Asuzu.
of disciplinary public health and community medicine. I did youth corps in 1978, and I was a medical officer of health for Ankpa local government in Benue State. The first task in my first week resuming office as medical officer of health is to visit the divisional agricultural officer, the divisional police officer, the divisional engineer, who is an HND in structural and civil engineering, the divisional police officer, the divisional educational officer, and the Eji of Ankpa, the paramount ruler, retired colonel, to let them know that public health is all of us. And so we let everybody understand what happens in public health that involves them. When we had infectious hepatitis, I called the agricultural officer because the Ankpa River was suggested to be the source of it. And so on and so forth. We are taught this in schools of public health. We are taught this in the office of medical observer. We are taught that if you have rabies, you must find out who covers, who is the veterinary medical officer for the local government where you are, to find out what is happening in the animal world.
Yes.
So that's how far it is. It has been. The raising this up to a national, international, everywhere level is good, but the conversion should be at the heart. And when it is, wherever we are, we can do One Health. We don't have to wait. What they do at the national level, at the regional level, fine, we can join them. We formed in 2011 a society called the Society for Public Health Professionals of Nigeria, which is a federation of disciplinary public health practitioners, professionals, and disciplinarians in Nigeria. Veterinary public health has refused to join it, in spite of pleadings. Dr. Agungbade returned from the US. He's a vet. He wanted employment in UI and IFE. We say we can't employ you at reader level because all these institutions are top heavy. So he took job in university at Ede, and they told him to craft PSC public health and BSc community health. He asked them, how can you train public health from the scratch? That's nonsense. They say he must do it. He said, no, you must come to public health with a discipline or a profession. That's how it is. They refused. He left the country. He boasted that he would get the vets to join the Society for Public Health Professionals. As I talk to you now, they are not part of it. At that time, there was no Veterinary Public Health Association. We told them even the Veterinary Public Health Caucus within the Nigerian Veterinary Association can join. Up to today, I'm confessing. Now, we started the Epidemiological Society of Nigeria, APC, in 2010. We put Cadmus there as deputy editor-in-chief. to show that epidemiology is everywhere. As a resident doctor, even as a medical student, we used to invite Professor Gabriel Eshuru to come and teach us in community medicine. He talks about epistemology and all that. He teaches us about anthropozoonosis, zooanthroponosis, amphixzoonosis, that the medical doctors didn't teach us. We just know zoonosis. So the cooperation had been there since my childhood as a student, a medical student. So these things are in the heart of man. All of us. Is not, those higher levels are good, though, but it should be in our hearts. In the APSUM, we just had the national conference in Calabar, we just finished. Not a single vet was there. And in that society, we had Professor Shurosho to be chairman of board of trustees. He died. We appointed Professor Peter Timothy EOB. He died. Now we are looking for another vet, experienced veterinary public health person to put on the board of trustees. We haven't found. So the effort, that's from the heart of man. So I'm telling my story so you will know all these other talk, international level, national level, fine, but it's in our hearts. If it's in our heart, we know it. We can generate that cooperation anywhere we are. Thank you and over.
Yeah, let me add some. Let me add. Uncle, are you still around? Is my uncle from the village, Okeja?
I am here.
Yes, we had a club association talk shop, and when they introduced me as a president of MVMA, when I was the MVMA president, he came to me quietly and raised this point. I had an opportunity in bringing him to this platform to speak on breaking the iron bars between veterinary medicine and human medicine in Nigeria. He spoke eloquently for 2 hours. We allowed him. He exhausted. Some people, Professor Junaid from Sokoto, who moderated it, said he would join. And you see, the ball is in our court. You know, when we are saying that we should expand our frontiers, it's like this thing he's saying. So please, let us do another introspection and be able to ask ourselves some basic questions. There are certain opportunities that are flying about. How do we key into it? Prof, you're welcome, sir. We've not seen for a while.
Thank you, Professor Asusu. Indeed, I know your name more in the veterinary world, even more than in the medical world. I almost thought you are a vet, but I know you are a medical doctor. I'm sorry for calling you Red Me before. Your name has changed now. But what was appearing before was Red Me C. Thank you very much for your perspective. We really appreciate it. And for the younger generation here, you need the benefit of hindsight from renowned and old people like this who have long year of experience in these fields. You can imagine this is a person who had been in practice since 1978. At least that's post-graduation. So definitely for us to have such a person on the platform is a benefit to us. Please, Dr. Chiloka, before I call
on top
you,
of it,
the president.
He retired from the Department of Community Medicine, UCH.
Medicine, yes, UCH, yes, I
UCH,
know.
as a professor of community medicine.
Yes, so I would like to call on Dr. Enahoro. Please, Dr. Chiloka, hold on for a minute because a question was raised which involved him before, and I see he's back on the platform. At least he's here. I saw him trying to talk the other time. Dr. Enahoro, please, earlier on when I think maybe you take a break, maybe a walking break or so, a question was raised about the proposed joint journal between the MVMA and NMA in Nigeria, whether it took off or not, and what had been the situation up until now. Please, if you can respond to that, or if you have other comment, please feel free to share now. Thank you.
Thank you, Prof. Are you hearing me?
Yes, we can hear you.
Sorry, I saw somebody off, and then I was using the YouTube to monitor the proceedings, and then it was slower or faster than the Zoom. So that's why I couldn't make my immediate response. Anyway, here I am. Yes, like Charles said, we had that intention to partner together, the NVMA and NMA. That was when Nabulili was president of NMA and I was president of NVMA. We did a lot of initial talking. I think the challenge has always been about the funding of all of these kind of programs. Remember when there was the technical committee for, was it COVID then? Or even Ebola? Yes, we had Professor Tumori as chairman. It was a 15-member technical committee. Apart from Tumori, who is a vet, he wasn't even in that committee as a vet. Anyway, he was there as a virologist, world renowned. There was no vet on the team because the sponsorship is always from WHO, and those who pay the piper always dictate the tune. So it has always been looking at most of these activities from the side of who funds, and then people are more interested in what is in it for me. You see, but beyond all of this, when we are talking of One Health, we really have to look deeper into this. We need to be very sincere and intentional to allow it to work. And that means the enthusiasm must be the same. The enthusiasm is truly more on the veterinary side today than in environment and the human health. Let us be very sincere. Professor Suzu is different. He has been very much willing to have inclusiveness from all other components. He has tried. We know you, Prof. But beyond you, I can't really see anyone who has been thinking like you. So we need the enthusiasm to be the same or to be close without necessarily looking at the monetary gains to the sectors when the unity or the partnership comes into play. I think that's the problem we have. So that unity we started in 2012 was abandoned at that same level because those who came after us did not have that that kind of relationship that NVMA and NMA had at that time. I think that's just about what I will say for now.
Thank you very much. And you see, that's very important. What you've said is really, really very important. Imagine Dr. Enabulele went on from being the NVMA and for the NMA chair to become the World Medical Association chairman. And we also have one of our own who went on to become the upcoming World Veterinary Association chair. Now imagine we have this type of zeal and we carry it on national level into continental level into the global level. It will do a lot of benefits to not only the two professions, but even to the wider society. Because what we need is a whole of society approach. And that's how we should be thinking about whatever we do. We shouldn't think from the prism of our profession alone. Think of the wider impact on the society. Think of the benefit to humanity. And think of how our professions are used as tools to collaborate with others and to jointly benefit the wider platform and everybody. So I will leave the floor to Dr. Chieloka to ask his questions so that we can make progress. Thank you.
Sorry, sir, to add to you, the president of the International Epidemiological Association is Dr. Adebi, International Epidemiological Association. He's a Nigerian.
Yeah, you can imagine.
We are there. It shouldn't be single persons. We should.
Thank you very much.
And Adebi wants to work with everybody, as far as I know.
Thank you, sir.
Good morning.
Dr. Chieloka, please. Yeah.
Good morning, sir. Sir, thank you for what you have been doing. I think another area that we can really leverage on to drive home this One Health agenda in Nigeria is looking at the intercommunicability of the various disease databases in Nigeria. I'm aware that the Federal Ministry of Livestock have NADIS, National Animal Disease Information System, and Federal Ministry of Health has the SOMA, Surveillance Outbreak Response System, and also Ministry of Environment has an integrated national environmental health surveillance system. I'm looking at a way where we have something like, because in a program you have what we call the application protocol interface, in which where we can isolate some those diseases that are zoonotic, that are peculiar, that cut across professional line, so that a veterinarian at the abattoir level that is doing meat inspection, that notices a trend in suspected or confirmed tuberculosis case, can actually link it to increased incidence of a tuberculosis outbreak in a clinic that is within that geographical area. And that will be subject to having information, quality information, communication of these three databases, in which they report on the spot immediate suspected outbreaks or cases of this outbreak, so that you can easily sit down where you are, geolocate, know that there is a link between the abattoir, people falling sick, and then reported incidents in each clinic or hospital within that geographical location. I think where we can really drive this thing up is more, first of all, communication of those disease databases. I don't know the bureaucracies that is stalling it, but I believe once these databases can really communicate, leverage it on zoonotic aspect of the diseases that are peculiar to all the three professions, because the one for environment, that one leverages on risk factors, environmental factors that contribute to disease outbreak. So when they communicate, we can really marry this communication together and really know how to manage diseases, and also further the One Health criteria agenda in Nigeria. I also want to end with this. I'm also aware that the Nigerian Field Epidemiology Program, they are one body that has actually integrated the World Health Agenda, One Health Agenda, and where we have the veterinarian, the medical doctors, and even environmentalists come together in a classroom environment where they are trained on a field epidemiology. I think that could be cascaded to the state level, so that it won't be only in Abuja or at the national level. And when these people are trained, everybody disperses, you barely hear anything anymore. I think that should be cascaded to the national level. Thank you.
Yeah, thank you very much for those comments. Quite apt, and it's really what we need to do. It's talking basically about the semantic and technical interoperability, wherein the platforms that is available for one can be shared with the other without compromising the security or data security of whatever is available across the platform. And that is really where we need to go. Indeed, we've seen that operated in some countries. For example, in Tanzania, we created, the MRI is used for animal health, and they have a similar tool in human health. And then we created a four-way linkage wherein the lab, the epi in animal, and the lab in epi in human can talk to themselves. And I can tell you, it reduced, for example, in Tanzania, it reduced the reporting time to less than 2 days. For example, if you send sample now, you can get your feedback in 2 days. And indeed, USAID funded that project, and they were really happy. Indeed, they celebrated it. It came out in a White House press release to show you the importance of something like that. So we really need to begin to think of how to do that. And one other challenge we have with that is that we don't talk about our success story enough. We have success, we just want to limit it or put it in a peer-reviewed journal and then publish it. No, we need to also be speaking to the society. Mention this success story, talk about what we've done, talk about the success. For example, I just saw a comment now from the DVS of Lagos, Dr. Boyega Idris. He happened to be my senior when we were in the undergraduate days. Actually, it was saying the operationalization of One Health activities at subnational level will follow the integration of the apex bodies at health, agri, and environment. This is presently being pushed, especially in Lagos, and through the likely the triad ops will cascade to other states following the national operational guideline. I can talk to that. Really, I've seen some very good example in Lagos State. I've seen the commissioner went to the abattoir and closed down the abattoir, I think, for almost 2 weeks, and said that until this improve and that improve, this abattoir will not be opened. And the people have to comply for the abattoir to be reopened. So we need to begin to think along that line and make sure that we don't need to wait for the national. If a state can do a good example, Showcase your example. Things like this, package it, bring it to the MVMA, take it to the NMA Congress, and talk about it. Talk about what you've done. Such success story should be shared across platforms. So we as professionals, we are not reactive. We should be proactive. Instead of being reactive as we currently do, and we need to purge ourselves of this mindset. That's the reactive mindset. And which is akin to mental slavery. So this is another comment from another person. Thank you very much for those comments. There is no hand here. I can raise another thought-provoking question, which we mentioned before. So, okay, so Dr. Muhinda, I would like to ask you, on the issue of economics and prevention versus response. You know, every major outbreak from avian influenza, Ebola, COVID-19, they've been followed by a surge in funding for preparedness. And only that funding dwindle when emergency passed. How do we, both national and international bodies, begin to make economic case for sustained investment in zoonosis, like the wider One Health platform during peacetime? We don't need to wait for crisis time. And what specific data arguments have you found most effective in convincing the Ministry of Finance, which are important, and international donor, so that they can begin to think along this line, please?
Okay, thank you very much. Let me do, before I respond to your question, do a small comment. I like what the DVS Lego said, because we have to celebrate whatever we're also doing, because the positive mindset will also be replicated for sure by others. There is also an interoperability of data. We are thinking about a program that will put together three data that exists already. On human health, there is IDSR. On animal health, there is NADIS. And on environment, there is INHAS. So those are three systems of surveillance and reporting disease. But we are working, it is very urgent. We're working together in One Health to make sure that what you say is true. When you get a disease, you are on the field, you see the signs, you send the sample to a laboratory, human laboratory. Quickly, the guy in the animal health should get a report in 2 minutes after you have integrated this. And people in the environment, so that will easy the response and the reactions. So now, what is the funding mechanism that exists? There is already a global funding mechanism that are discussed on One Health. I can tell you, FAO, WHO are together always to talk to donors so that bigger programs that are happening will be addressed. The recent case of Ebola in DRC in Uganda, they are addressing this together. And some donors have accepted to put money. I'm sure they are talking to WHO. When the DG WHO went there, he spoke to both FAO and WHO representatives. So the report is done together and they will address this issue together. That is where One Health is going. This AMR Global Conference that is coming to Abuja is about funding AMR at global level. And the four head of agencies are supposed to come because they see this very important. That is at the global level. But at national level, we also learn from them. Since we are doing One Health strategy in each country, we started by One Health work plan that was funded by scattered budget from different ministries. And now we are talking about the strategy for 5 years in the country, where we go to donor and tell, this is what we are going to address in the One Health sector. This is the development strategy is also bringing in the investments, One Health investments. We are doing a case One Health investments, especially in the country here. We have finished already a draft using the capacity of investment center in the FAO in Rome. We are doing a case of One Health investments a plan which will be sent to donors who are working on the global health security, who has money. So we are mobilizing now together. We are making sure that One Health is funded at global level, depending on the cases that are happening, and at country level, case by case. At country level, we will do One Health investment plan that is submitted to donors for being co-funded. And we are asking for each country that even the funding that from country should be eco-funding to make sure that we get a funding. So there are many international funding mechanisms existing now. The first one, that is the daily hanging fruits, is the pandemic fund. You have heard, all of us, we have heard about the pandemic fund. Is a funding that's put together at the global level to address issue of outbreaks. And this is funding each country in a sectoral way. We'll put together all the necessary, this investment plan will be put together from human, animal health, environment. We are even now adding plants because we have seen that something like aflatoxin is killing 100,000 people every year. This is from plant side. You harvest, you don't harvest very well, you store, and a fungi will develop, and that become a threat for human health. So plant health is also coming in. So when we do a proposal for the pandemic fund for a country, we integrate the 4 sectors. If it is not integrated, the pandemic fund will not give money to a country. This is one of the examples that is at global level is working. Pandemic fund has already donated money. Now we are 26 countries in Africa, almost 500 million for on the continent. Nigeria is expecting very soon a funding. So it means that if you don't do in a sectoral way, you don't integrate the 4 sectors, this is one of the conditions. You will not get money. Today, we are talking about Jeff 7, Global Environment Facility, the 7th generation. They're not looking yet only on deforestation. They are looking at the consequences of deforestation in a country. We were discussing with some of the states in the south. So we are looking at deforestation, also the consequences of deforestation, because many disease spillover are coming from the deforestation. You know, in some areas we didn't have Rift Valley fever, but because of removing forestry and making the area savanna being warm, mosquitoes are moving. And in some countries, Rift Valley fever is now becoming outbreak where it have never existed before. So we are integrating the global financing mechanism that is there, the Global Environment Facility, Global Climate Change Facility, Pandemic Fund Facility. All of them are looking at an integrated proposal. If it is not integrated, you don't get this facility funding you. So this is something that also I want to bring in. Especially, I have seen that some of these facilities are even accepting private sector-led proposals. Important because Nigeria is a majority of the economy is private. So private sector-led proposals are accepted now at the Global Environment Facility, very soon in the Pandemic Fund. So it means that we need to work ourselves and look at the things in that perspective. One Health is becoming important. One Health is the future of the global health security. There's no way you can avoid it. So we need to make sure that we align timely and get facilitated and get all these financing facilities.
So thank you very much. Thank you very much for your perspective, Dr. Muhinda. Really, that's what you said is really, really very true. You know, last year I got involved in the Nigerian pandemic preparedness proposals. I look at the two previous ones, and I found out that yes, the issue of the One Health were not clearly showcased. You know, One Health is not just about we want to do this and we are informing you about it. No, it's about joint planning, joint implementation, joint funding, up to joint outcome. So this is what One Health is all about. And you know, for countries that are making wins in the global stage, for example, on global environmental facility, uh, climate change issue, because they also have funding, this issue of pandemic fund and other funding mechanism. They are looking for people who can collaborate. We tested this in South Sudan. I think in late 2024, we prepared some proposal together for them. No, early 2025. And at the end of the day, the country was able to get about $21.6 million through pandemic fund in terms of implementation. And so like this year now, I think Nigeria and just 13 other countries have been targeted to actually submit proposal. That means the money is already there for you. What they're only looking for from you is submit a joint proposal and let it showcase that you are working together, not working in isolation. So the funding is there, and you can attract up to, I think, $25 million from the pandemic fund. For the global climate change or climate environmental facility, those one, you can even attract billions. He said, you have to show that you are working together as professionals, not in your isolated cocoons. Nobody wants to be a king here and leave others behind as the people you rule. So this is not how the world works. So if we want to benefit from the world, and nobody will dispute the fact that the country, Nigeria, is actually positioned. You know, you are right at the center of everything that happens. Imagine almost 1 out of every 5 Africans is in Nigeria. Imagine the impact of Nigeria on global trade and tourism. Imagine a zoonosis happening in Nigeria and people begin to move it out to other countries. So we are right in the middle of a position for funding, but we really need to begin to think and change our mentality. You know, as the topic of today is a global perspective on zoonosis. So we need to begin to change our mentality from looking at every issue from from my microscope or from behind my clinic to move into your subnational, to move into your national, and to move into international platform. And definitely some of the quick win that we can do as vet, for example, issue of cost benefit analysis. Don't just address disease and say, oh, I've done the pathology, the virology, and the microbiology of it. Think of what are the economics of that disease that you've addressed. The cost benefit analysis may be very important. What are the return on investment on some of those things that you are doing? If you as a government invest 10 million in this, how much is it going to be the benefit in terms of the value that we are going to get back? Even valuing livestock assets. Do you know that till now, I've not seen a single comprehensive evaluation of any livestock asset in Nigeria? Think of our cows, our sheep, our goats, our poultry. None of this industry had done a comprehensive evaluation of what is the total asset that we have in this. If we can showcase that our poultry industry generates $5 billion a year, and we are now asking the government to think of between the national and subnational to think of investing $200 million. Do you think it will be a difficult thing? Then no, we don't do that. We keep talking, or we take a number out of the blues. No, that's not what economics want to deal with. Because when you carry your case to the Ministry of Environment or Ministry of Finance, the first thing they will ask you, how did you come about this number? So you need to have some robust background science behind whatever you push. I know we have just about 11 minutes left on this platform, and I know that this is a discussion that cannot be taken in 2 hours. Possibly, Dr. Muhinda, we may even have to bring you back for a second session if the platform owner permits that, because really the issue of this global perspective is important and they're very critical, and there are things that we need to do. We cannot shy away from them because we don't live in isolation. Nigeria don't live in isolation. We travel every day. We move around. We interact with people. And so discussion like this will always come. Even if you don't want to do it, people will drag you into it. So thank you very much for your time. I know that our time is fast spent. I would like to hand over back to Dr. Charles Ibe at this point in time for him to give us some advisory and some information, and also to begin to do the wind down on today's session. Thank you very much, Dr. Muhinda, and we really appreciate your time here. And thank you to all the people who had also made contributions, especially somebody like our former president. We have two former MVMA presidents here, and we have the renowned Professor Asusu here with us, as well as people like Loka. I know you have seen a lot of your work. Thank you very much to everyone who have contributed questions and comments. I hand back to Dr.
Yeah,
Ibi.
thank you. You can see, Dr. Muhinda, that you are now our customer. So start preparing your mind on certain topics that can educate us, increase our value, and subject us to radical thinking. What I will do now, like I did before, between Professor Asuzu, my uncle, and Professor Junaid. I don't know that it didn't. They made a lot of promises that they're going to continue, but it looks like there's a dislocation somewhere. What I will do is on a broader spectrum link two of them together. Professor Mike Asuzu is a professor of community medicine, retired in UCH, University College Hospital. I don't. Is this still called UCH? Does this still make Unibadan a university college? I thought it is a full. I thought it's a full-fledged university. Now I always say University of Ibadan.
UCH is UCH.
Yeah, you see, you can see, and they are telling us that the first university in Nigeria. They are telling us that they are the first university in Nigeria. Meanwhile, we have the University of Nigeria, who started as an accomplished university, not as a college. You know,
debate we have at other times.
I used to tell them that their VC was a principal, just like my secondary school, Melambi. You know, these are the GRs. And anyway, whatever be the case, I will link two of you together, Otto Muhinda and Asuzu. If there's anywhere at that your any area that you can subject yourself to cooperation, if you can think it out and widen it out. We're almost at the end. Somebody talked about private investors intervention in the abattoir. We have been talking and talking and talking. I bet one day they will bring us in. I remember one government that brought some private vets. Anambra State, let me just be, because the way I talk, I don't talk from two sides of my mouth. They brought some vets, private vets, to do some of their job. One day, when they saw that those vets were making a lot of money, and those in the government are being shortchanged, they came one day with police. I said, hand over your receipt or invoice you're having. But you see, in that case, I mean, there was no legal as foundational. There was no legal, come and do something. I said, no, let's go and tie the legal ends. Because if there's legal ends, nobody ever will come and ask you that invoice. Or you go to court to sort it out. But being they told you, go and do this, you went to do it without signing agreement. Cut back at most times you spend some money at the foundational, at the fundamental, so that it will endure. So that's what I'm bringing out here. If not, and we tell those in government, one day you'll be like us. So don't worry. We're in a highly, follow and show you are raising your hand. I don't know why.
Yeah, sorry, just what you said. I want to think that for such a thing, you can bring somebody like Dr. Idris on this platform one of those days to talk about this. Lagos has some very good partnership between the private and the public, and is working very well.
Okay.
Thank you.
I will bring him. Dr. Idris.
Yeah, Boyega Idris.
Okay, yes. You replaced my friend. Well, that's okay. I think he's 1 month in the job or 2 months in the job. So whatever we are saying it for our common good. We are saying it to expand our frontiers. We are saying it to not to be conscripted or constricted in a spot. We are saying that the world has globalized so that we think global. We are saying it for a lot of foundational and fundamental issues that we might be sitting on gold mine. It's only when you dig it that you know that gold is under. So how can we dig so that we see the gold under us? I am saying it, the profession of veterinary medicine is a gold mine. I'm an example of it. But the only thing is that if we crowd it on personal-centric adventures, it will not lead us anywhere. We need to broaden our perspective so that other people can broaden and over-broaden, and the space will be wider for us to ventilate and have a piece of meat out of it. So on this platform, we'll think about who we bring. Maybe Idris will come next week. Idris, are you ready to come next week? Hello? Boyega?
Hello, sir. Hello, Oga.
Are you ready? You replaced Macaulay.
Yes,
Are
sir.
you going to come and tell us partnership in Lagos?
I will need to get clearance first, too. You know, I'm a civil servant.
Oh, so when do you talk to me? How do I get your number?
I've given it to Follow already.
Okay, Follow has it.
He's
Okay.
my guy.
Don't worry, they will give you. Lagos is it's a pragmatic state, honestly.
Yes.
So don't worry, they'll
Alright,
give
sir.
you.
Yes,
Yeah?
we leave always.
Lagos is a pragmatic state. Anything that can bring common good to everybody, Lagos is on for it. So don't worry, they'll give you. So by Monday, Tuesday, when do you want me to call you? Tuesday?
I will want to have your number as well, sir, so we can chat.
Yeah, okay. Follow Inshaw, please. Oh, fashioner, do the needful. We can
Yes,
chat.
I will link the two of you together.
Link us together. Don't worry. I'll follow. Sorry, Idris. Once I follow you up on a hot chase. I don't know. Have we met before? Do you know me?
Very well, sir.
Okay, you know the kind of person I am. I am a I've never worked for civil service. I've not worked for anybody. I started on my own from the scratch. So whatever I do it from somebody from. I know when you start the way I started with zero money, you have to be a radical. Yeah? There's no looking back when you face something. Now I'll face you this week. Thank you very much. God bless you all. And thank you for waiting. 25 for us. He has mentioned a lot of people. We have Dr. Ambali here. We have Dr. Amali here, immediate past DVS of Benue State. We have Dr. Mbafo from Cameroon. We have Boega Idris, DVS of Lagos. We have Professor Mike Azuzu, the retired. In fact, there are Unimed, not Unimed Dugiri. There's one University of Medicine called Inondo. He went there on contract. I don't know whether he's still there, but I believe he has done it, but he did most of his work from is it in Kogi State, Ampa, from Ampa to UCH, and from UCH to be a professor. So he's been on a cascade from the ground up. Who again? Then we have our lead speaker today, Otto Muhinda. We have introduced him, and my beloved brother, Professor Fashita. My eternal brother, Professor Fashita. The only thing is different between me and him that I don't have tribal mark. Maybe I'll go and pick up one. All the best. Thank you very much. Have a wonderful weekend. For those going to party, make sure you party well. Party well.